Doctors of Reddit. What happened when you diagnosed a COVID-19 denier with COVID-19? Didn't diagnose a denier. So not exactly this. But did have a patient refuse testing upon admission and aggressively yelling, "COVID as a hoax." I calmly said, "Okay. Nurse. Since we won't know his status, please admit him to the COVID floor." He became a believer in an instant and requested to be tested. I was testing a guy yesterday who asked me if he still needed to be tested in order to be on a college campus even though he had received both doses PF Pfizer already. I said yes. It's a CDC mandate. And there isn't enough longitudinal study on the current vaccine's effectiveness on the variants to make a call on that yet. So we keep testing everyone once a week. Then he hits me with, "You know all this COVID crap is bullshit, right? Fucking government and Illuminati spooks trying to suppress us." I told him that 92 people have died of COVID under my care in the last 14 months. To keep his QAnon garbage to himself and to have a nice day. I got reprimanded this morning, lol. Most worth it slap on the wrist of my life. Edit. Hey. Thanks for all the sweet Reddit clout. In lieu of any awards that may cost money, I would instead recommend that you donate to the Nurses House, which is a foundation that assists RNs struggling with mental and financial well-being. They do some great work. Thanks again. I'm an ODP and work alongside anesthetists in theaters and ICU. To be honest, I've not really seen anything from patients regarding outright denial. However, I have seen some of my friends on Facebook who have spouted all sorts of lies. That's really disappointing to say the least. One of them, a friend of my wife, works at the hospital. She works in admin and refuses to wear a mask and even bought some certificate off the net so she doesn't have to wear one in public. Anyway, that's being escalated up the chain of disciplinary action. Infectious disease doctor here. Seen about 450 to 500 COVID patients in the hospital since it all started. Only one patient ever accused me of using the nasal swab to give him COVID, along with a microchip. A handful have. Edit. Ranted non-stop about China. Everyone else has been sick enough to accept it. But lots still refuse the idea of vaccination even after being in the ICU. As an anesthesiologist, by the time someone's calling for us, it's for intubation and the patient is in no condition to deny anything. Honestly, it's usually the family that's the issue and that needs to be escorted from the room. My wife's a nurse. Just had to deal with a patient who refused to get tested prior to her surgery, so they had to treat her like a COVID patient and needed to charge her for all the added PPE like gowns, goggles, etc. The kicker is, recovery wouldn't take her for observation while she was woken up, so the anesthesiologist needed to stay and monitor her in the room for nearly 3 hours. They are billed at $400 per 15 minutes and there is no way her insurance is going to cover the extra cost because she signed a document saying she denied a COVID test. I had a lady who was maxed out on high flow. Next step is breathing tube, who still refused she had COVID and was holding a negative test in her hand that she had taken a week prior. I work on a COVID unit and I ran into a patient like this. They'd tell me over and over again about how they weren't really sick and about how I didn't need to be gowned up in PPE. They even tried to take my face shield off. If you test positive for COVID 2 times, then you have COVID. People are crazy. I'm a family doc who mostly does outpatient. I live in a pretty conservative area with a good proportion of COVID deniers. So I've been seeing COVID deniers since this mess became politicized. I've lost a few patients over the mask mandate. Anyway, I'm pretty pleased to say that several of my COVID-denying patients have completely turned their attitude around when they, or a close family member, contracted COVID, even if their case wasn't severe. The sudden terror that they could wind up on a ventilator overnight really puts the fear of God into people. Unfortunately, I still have some patients who are still pretty obnoxious despite their COVID diagnosis. They mostly dig in deeper into paranoia. If not about the virus itself, then about the circumstances surrounding them contracting it. If Fauci had done his job from the beginning, it never would have hit this town. It's the entire fault of Obamacare that I can't get the experimental immunoglobulin treatment. Quote, "It's not. Your eligibility for the infusion is dependent on a list of risk factors. And, probably my favorite, so I have COVID and it's completely your responsibility to fix it. I need you to send hydroxychloroquine, zinc, Vit D, lisinopril and azithromycin to the pharmacy. Then they proceed to get pissed at me when I don't." And yes, each of those things were actual things patients said to me after getting their diagnosis. I could probably think of more, but those were the most memorable ones. Family members have come in with a sick family member and lied about exposure and/or symptoms, despite a member's testing positive. This has lead to inappropriate management, delay in treatment, and exposure of staff and other families. The family members then get angry when told to isolate. Edit. Typo. My mom works for an OB/GYN who specializes in high-risk pregnancies and births. And he was called into the hospital to check out a woman whose due date was about 2 weeks away and who was very sick. He confirmed she had COVID and admitted her to the hospital until she gave birth. But she insisted it was a hoax and ended up checking herself out AMA. But not before she spat in the face of the nurse, who coincidentally had just completed chemo. That was near the beginning of the pandemic. And I'm so curious what happened to that lady. The nurse is okay, thank goodness. Not a doctor, but nurse that worked in one of our COVID ICUs. Lady was intubated, sedated, prawned. Therapy that involves lying the patient on their stomach in order to oxygenate the lung more effectively. Reserved for very sick COVID patients. The whole shebang. Miraculously she recovers and is weaned down to high-flow nasal cannula. Still a fairly high oxygen requirement, but better than needing the breathing tube. This spiteful she-devil would purposely cough on us nurses as we went into her room to give meds, care, simultaneously yelling that COVID isn't real, and that we gave her COVID face with rolling eyes. God, this winter sucked. My worst experience was when a 2-year-old kid got diagnosed with COVID. His mother had brought him with CO fever and diarrhea. The child was severely dehydrated and so we had to do a mandatory swab test since we planned to admit him. It came positive and the mother refused to admit it. We were ready to perform a repeat test and we even advised for the parents to get tested. Her defense was, the child never left the house. It's just I and the father who go to work daily. The grandmother babysits while we are away. How can he even get COVID without leaving the house? She had called her husband. He came with 10 to 15 relatives in a car. They broke a few chairs and then left with the baby. We just informed about the case to the COVID control center. They just kept denying they had it, stated they had something else, and tried to leave against medical advice while on high-flow nasal cannula, which we didn't let him do because he would have died within minutes before he was admitted to the hospital. He was symptomatic but refused to isolate at home. He gave it to his wife who ended up in the ICU. Doc chiming in. They told me I was wrong. Obviously. There's no way they had COVID despite coming into the for shortness of breath, cough, and fevers. When I mentioned that their wife who was several rooms down also had COVID, their response was, "Oh, that makes sense because she always gets sick." When I asked how it made sense that they wouldn't have COVID with the same symptoms, I was told that it was because they were overall healthy and only took their mask off to eat and drink in the casino upside down face. I'm an anesthesiologist, and in our institution, we're the ones tasked with intubating COVID suspects, positive patients who would otherwise die without ventilatory support. And holy hell, there are a lot of patients who don't believe COVID is real. Most of them believe that it's just an elaborate lie that doctors use to label random patients to mooch money off them. Some of them scream at us, in whatever capacity their diseased lungs can allow them to. Some outright refuse intubation, in which case they die several hours later from respiratory failure. It's emotionally taxing having to face that every shift. RN here with most of 2020 spent in COVID land. I never had anyone refuse treatment when things got serious. I know some of the MDs I worked with got yelled at, like the rest of us. But honestly that happens frequently anyway. Some denier patients lived, many of which had accepted reality by the end of their stay after seeing what we all were going through to treat them. Some died telling me I was a sheep or an idiot or a liar between gasps of air. COVID didn't care. Not a doctor, but when my grandmother was dying, my relatives kept pushing me and the doctors to say what it really was. It added so much stress to an already difficult situation and was embarrassing as well. Even after she died, they kept saying things like, "What if it was a stroke and she was misdiagnosed?" Don't you think they just didn't want to help her? I was trying to arrange with hospice to go in and say goodbye, and my stupid second cousin was sending me YouTube videos about how COVID is fake. I was already not close with these people and I am glad they are out of my life now. I work in psych and the biggest issue has been people requesting letters stating they don't have to wear masks because of anxiety. I absolutely will not write such a letter, and the amount of times I have had to explain that not only to a PT but to therapy staff who feel so bad for the PT is astronomical. I always give a detailed reason why, but I know no one is listening once they figure out my answer is no. Our neighbor was a COVID denier. So he wanted to prove that his healthy lifestyle of CrossFit would prove it is a bad cold. He now uses a mobility scooter to reach the mailbox. Speaks like Stevie from Malcolm in the Middle. Takes more pills than people twice his age. And can't taste or smell anything.
If you enjoyed this video, please check out our playlists full of similar content. Epicaricast is like doom scrolling for your ears. Please like, share, and subscribe.